Don't kiss your baby on the mouth. Hi everybody, it may not look it, but I am actually a licensed and practicing general dentist in the state of Kansas. And more importantly, I'm actually a newborn father to a beautiful baby little girl. And it's my first time being a dad. And I was just thinking, what would I want to know if I wasn't a dentist? So this video is basically a newborn survival guide on everything you need to know, dental version for new parents. So the first thing, which is kind of weird and a lot of parents don't recognize, but you should not kiss your baby on the mouth. And it's weird because you want to, and I know it's very tempting, but when you kiss your baby on the mouth, you transfer the bacteria that's from your mouth directly to the baby's mouth. There's two major types of bacteria that really cause decay and gum disease, and those bacteria are not present when the baby is born, and it can be very easily transmitted through kissing or through sharing of utensils. So you really want to avoid that stuff for as long as possible. That would inevitably delay the process of the baby's mouth being colonized by those bacteria. You can imagine with things like infection. If you have an infection in your mouth and you kiss your baby, that stuff can be transferred and it's not good for the baby. So as tempting as it is, try to avoid kissing your baby on the mouth if you can. Point number 2, which is near and dear to me because my daughter has a pretty decent tongue tie. So tongue ties are interesting because back in the day they were pretty aggressive with them and they would come back and they would cut the tongue ties. Nowadays, the recommendation seems to be from the ADA and the AAPD is that you should be as conservative as you can when in regards to tongue ties and lip ties. So what exactly does that mean? That means if the baby is functionally okay, if the baby is latching, or if the baby's eating okay, and if the baby's not having speech issues later on, you really probably can delay the removal of a tongue or a lip tie if that's the case. You really do want to consult with multiple entities, which would include your speech therapist, as well as your pediatrician and lactation consultant to see if the tongue tie really needs to be treated or if there are other methods before jumping directly to tongue tie surgery. The reason why they try to stay conservative is because when you do remove the tongue tie, they often remove it with a laser, and post-operative healing can be sore and cause pain to the baby, and that can actually lead to even more latching issues and more feeding issues. So we try to take the conservative approach if we can. Point number 3, which is pacifier usage. So pacifiers are good. You have to weigh your personal pros and cons to see if you want to use them. But generally speaking, I believe pacifiers are linked with a reduction of sudden infant death syndrome. So it's got good qualities for pacifier usage for sure, but you also have to know that it's hard to get a baby off a pacifier. Weigh your pros and cons. As far as dental concerns for pacifier usage, both the AAPD and the ADA recommend by 12 months, you really should start weaning your baby off of the pacifier. They found that by 18 months, you can notice some dental issues, as well as increased risk of ear infections, I believe. By 3 years, they really recommend you should for sure be off of the pacifier. Otherwise, you do risk long-term damage at this point, which over usage of a pacifier can include an open bite, which can cause speech issues as well as feeding issues and functional issues later on. So start weaning by 12 months, and by 3 years, you for sure should be off of them. Ideally, less than 18 months, you should be off of them. Point number 4, which is an odd one too, but brushing baby's mouth. You always think that baby doesn't have any teeth, so what would you be brushing? But the reality is the oral cavity is a dirty place, and when you feed it food, inevitably bacteria will be present. So although they don't have teeth to brush, you still want to wipe their mouth. There's a couple ways you can do this. The easiest way is just get a piece of gauze and wipe it before bed. But they do also make gauze that is attached to a lollipop stick, essentially, that allows you to wipe the mouth a little bit easier as well. So baby does start getting their first teeth around the 6-month mark. Typically, the first tooth will come in around 6 months, and then the last baby tooth will come in around the 2-year mark. they will typically have 20 teeth. So 10 on top and 10 on the bottom. Interestingly enough, the lower front tooth at 6 months is usually the first tooth that comes in, but teething pains can actually start far sooner than the 6-month mark. It can start months earlier because the tooth, although it's not showing, there is a bud that is formed under the gums, and that bud is pushing up towards the gums, which can be causing a lot of the teething pain. There are ways that they recommend for treatment of teething pain, but there are also many recommendations what not to do. So let's start there. The first thing not to do is to use over-the-counter or topical ointments like benzocaine or Orajel. They are found to be very dangerous for little children and little babies, so avoid using that if at all possible. There's also a common holistic approach that people will preach to use honey, which is also a big no-no. Honey can have botulism toxins that are very susceptible to a baby, especially before 1. Some other big no-nos that are often used is using completely frozen items. Completely frozen items are too hard and can actually cause damage to the gums and hurt the baby. So think of it this way: don't use completely frozen, use chilled. So the things you can use is a rubber teething ring, chilled in the fridge or chilled in the freezer for a little bit. There's a holistic one, which people use green onions that are chilled and cold. You have to be careful with that as well, because green onions can break and be a choking hazard. So if you do use this method, just make sure you're watching the baby. But it is a good method because it has some anti-inflammatory properties and it allows baby to suck on them. The ADA and the AAPD both recommend using chilled items like a chilled wet cloth for baby to chew on, or a chilled teething ring for baby to chew on that is usually made out of rubber. The other methods that are good for this phase is to use distraction. So pacifiers, feeding, breastfeeding, bottle feeding, and just extra cuddles for the baby are good ways to help treat the teething pain that they will likely have. Now, the sad thing about teething pain as a parent is that although it is not the worst pain that they will ever have, it is the worst pain that they have currently experienced up to this point of life, most likely. So it's a sad thing, and you're not going to be able to cure all of it, but just do your best and just know that Father Time is the great healer here. As the teeth come up, the teething pain usually subsides. So the new recommendations for the American Association of Pediatric Dentistry, as well as the ADA, recommend that as soon as the first tooth comes up, which is likely this lower front tooth, that you start brushing them, and you start brushing them with toothpaste. So when you brush with toothpaste on their teeth, even if it's just one, you want to start off with just a smear. And they call it a rice grain amount, especially when baby cannot spit. As baby does get older, into the 3 and 4 year range, and they can spit properly, you can increase the amount of toothpaste that you use up to a pea-size amount. For babies, it's just like adults. You want to brush twice a day, once in the morning and once in the evening, right before bed. People often say, why is it so important to brush before bed? The reality is, if you breathe through your mouth, especially at night while you're sleeping, you create a very dry environment, which is much more conducive to bacteria formation. So making sure you're brushing morning and night. Disclaimer, I am a dentist, but I am not your dentist. It's always best to consult with your local dentist and your pediatrician to get the best recommendations for your specific situation. The reality is, most of this stuff is my personal experience and what the AA, PD, and the ADA recommend. So you can always use those as your local resources if you have any questions about what to do, dentally speaking, for your child. Stick around. We talk about newborn dad experience on this channel, or newborn parent experiences on this channel. Keep watching for more dad content.